Thanks for
Well, it
joining.
wasn't so hard.
Thanks for joining. How is it in New York right now with
Beautiful.
COVID? Is it?
Well, right now the weather is beautiful. I can't say anything else is, but
Yeah. Yeah. You guys haven't opened any offices yet there, right? Any practices for plastics or derm?
well, we're open for medical dermatology.
Okay.
Not for anything else. So
Okay.
Fortunate,
Okay.
but
Yeah.
honey, I only see half of your face.
Oh,
there you go.
let me
back up a little tiny bit. Okay.
Okay.
That's
Better?
perfect. Now I can see you. Yeah, now I see
Perfect.
you. Much better.
Perfect. Thank you. So it's noon, and I want to introduce you to the people that I love that are going on this, and you know some of these people too. But I'm so thankful, Dr. Gendler, that you want to join us and teach us a little bit about sunblock and skincare, because you're like the master. And when we had a Zoom call with you, boy, was it 3 weeks ago already, or 4 even?
Something. It feels like it was longer than that.
Yeah. You had some great information about sunblock that I was kind of enamored with and in awe of, and I just wanted to have you share it with as many people as you could. And I think that everyone on this call is very interested in that too. So I want to just kind of let you lead out with kind of your favorite sunscreen, and I just want to ask you tons of questions.
Okay. Well, I don't want to say I have a favorite sunscreen, but what I can say is that I know a lot of you do a lot of injecting, but you don't really do skincare. I think I'm correct in saying that, Connie, am I?
Well, I think a lot of aesthetic nurses that do a lot of injectables potentially work with teams of estheticians and maybe physicians. Myself, am a plastic surgery nurse for 30 years, so I refer out to my dermatologist all the time for skincare help and estheticians. And as far as sunblock information, we learn it as we go, and we have a lot of companies that tell us different things, and we do a lot of research, right? But sometimes the research isn't as much as what you have in your brain, because that's what you focus on. So I would say that,
I'll try to simplify it for you. And my perspective is that if you are an aesthetic injector, doing injections and not doing skincare, or not making sure that your patients get adequate skincare, is like buying a new car and saying you're never going to wash it or clean it or polish it. And there's no point in getting injections if your skin is terrible. That is a fact. When I have elderly people, 90-year-old women who've been using Retin-A for 20 years, all of their friends tell them how beautiful their skin is when it's clear. It doesn't even matter if their skin is hanging down to the floor. If you have beautiful looking skin, it's much more pleasing to the eye than mottled brown scaly patches. That's a fact. So for all of you, if you are not already doing skincare in your practice, learning about it really, and either referring it out, many dermatologists don't even know that much about this, referring out to an esthetician or dermatologist who understands, or to you learn and do it. Mm-hmm. So I think that the cornerstone of that is going to be sunscreens. And this is a really confusing area, and I'm going to try to simplify it for you. I'm actually in the process of writing an article for one of the derm journals about it, because it's so disappointing to me that many dermatologists know nothing. They know really nothing about this. And it's scary, and it's unfair, and it's wrong. So the classic example is the patient who comes in and is very tan, and the same interaction goes on every day. And I say, you're too tan. Well, I was wearing a 50, I was wearing a 70, and that's where the discussion we're going to have is really important. And before we start, I want to give a little caveat. I had to get stitched up. I had a bike accident this week, so rather than have bandages, I figured I was going to sit like this for most of it. But so I did not inject myself. The bruises all over my body, and it's lucky that this is all that happened. Anyway, so here's the situation in the let's talk about this. Ultraviolet light divided into several categories: ultraviolet A, B, C, and visible light. The nomenclature SPF refers only to ultraviolet B, nothing else. Ultraviolet B, those are the sunburn rays. If you go in the sun and you have no sunscreen, you're going to get a sunburn. That's from ultraviolet B. Ultraviolet A, on the other hand, those are the tanning rays. Those are the rays that tanning booths use. So if you were to go into a light box in a tanning booth, and if they used UVB rays, in 1 minute, you could conceivably have third-degree burns, okay? So UVA is used, and that's why you can sit for longer periods of time, and it causes darkening of the skin. We know that UVA penetrates way deeper into the skin than UVB and contributes more to skin cancer and all the other jazz. It clearly contributes more to melasma. Does everyone know what melasma is? It's the pigmentation believed to be hormonal, but many men get it, and it tends to occur here on the cheeks and the forehead, and often in pregnant women. That's why it's called the mask of pregnancy. But women on birth control pills get it, and even if you stop birth control pills for 20 years, you can still get it once you've had it. At any rate, melasma is clearly more influenced by UVA than UVB. And then there's UVC. Those are the lights that now you're going to see a lot of because we use them to sterilize equipment and such. And then there's visible light. That's the light that just comes from the sun. It doesn't, it penetrates more deeply, and then most of it is absorbed by the ozone layer. So it doesn't contribute to sunburn, but it definitely contributes to pigmentation, and that's an important factor too. So in the United States, when you see the nomenclature SPF 50, 30, 40, that refers only to UVB. So we have excellent UVB chemical sunscreens in the United States. Mm-hmm. Excellent. The same ones they have around the world. However, we have terrible UVA ingredients, and that's what's critical. So you can use a product, say a Neutrogena SPF 70, 100, and the same refrain every day for patients. I was wearing my 100, I was wearing my 70, and they get dark. So you need sunscreens that contain UVA protection. In the United States, we have one chemical ingredient that protects against UVA, and that's called avobenzone. And it's what lends that sunscreeny smell to most products. And it's a lousy UVA sunscreen, lousy. It's safe as far as, safety is concerned, but it's not a good one. In order to make it better, they add tons of chemicals and antioxidants and all sorts of things to try to stabilize it, because on its own, avobenzene would disintegrate the moment light hits it. Now, isn't that ironic, right? It's ironic that the one thing you really want to be protected against, the one ingredient that's being added to help you, is an unstable additive. So they add other chemicals in. If you recall, there's been a ban in Hawaii and in Key West for certain chemical ingredients because they destroy or believed to bleach or destroy coral reefs. Mm-hmm. And two of